Hello, I'm Dorothy Kamaka. I'm a private patient advocate in Australia, and I have a company called Patient Advocates Australia, and we operate Australia-wide. And I am in a partnership with Alicia Dunn, who until a couple of years ago had her own business, and we found that joining together we had a greater skill base, and we could then look to helping different sorts of clients and each adding some expertise to a client case. So we joined together, and in the last few years since we've joined, the business has really taken off, and patient advocacy is becoming a little bit better known here, and largely word of mouth, but some of the things that we've been doing have been based on media presentations, and at the moment this year I think it's probably doubled in our client load. We advocate for people in the public system, in the general hospital system, or in the private system in the hospital system, and we also advocate for people needing aged care, already in an aged care facility, or whose family are looking to transition a family member into aged care. And we also look after people's health interests who are within what we call the NDIS, the National Disability Insurance Scheme. And we work with support coordinators or with the client themselves to help those people get a better health outcome for any experience they're going to have within the health system. Both Alicia and I have formal advocacy training, and that was vital. What we have gathered over the decades from our nursing experience and being fluent and literate in health management and in current treatment regimes was really honed by understanding how to be an advocate and how to focus the care away from the medical model to the patients, from the patient's perspective. So we really now have reoriented our view of patient health care from the patient perspective, and that's really a fundamental issue that we picked up from within our patient advocacy training. The things that we probably consider barriers to our practice are a lack of awareness of patient advocacy. We have people referred to us by word of mouth, and sometimes people see us on the media, but a lot of people in Australia don't know that patient advocacy exists, and that is the biggest barrier. The second barrier, strangely, is it's a bit of a smoke and mirrors. Patients think that doctors will object to them having an expert supporter on their team. They don't, and once we overcome that fear by patients, we find that doctors are really welcoming and really enjoy having somebody who is going to be able to really support their patient with some expertise. So the two big barriers, I think, are a lack of awareness and the patients themselves fearing that it may work against them when in fact it absolutely doesn't. Mostly the way we're getting around trying to put our name out there is social media and just the general public, the general media. We have a very broad client base. If I had one comment that I would make about my frustrations with the client base is that they tend to contact us a little bit later than they should. They wait until they're in trouble before they Google patient advocate, and then they know they've got a problem, and we tend to have to go in and undo some things and then collaborate with their health team to overcome whatever the problem is. About 80% of the problems that we encounter in the acute hospital system is what I would call governance. It's poor communication between specialists. It's a lack of, it's a siloing of information between specialists. It's poor communication between the specialists and the family or the patient. And I think I can't remember when we weren't able to improve a situation. It is just relatively simple to undo those problems if they don't get too far down the track. I can't remember when we last had an adversarial issue with a doctor in a hospital or a hospital itself. So that's not so much of our work. And we don't tend to get insurance issues with private health insurers. In Australia, private health insurers do not refuse claims very often, so that's not a very large part of our work. We typically get somebody ring up and say, look, my mother is at such and such a hospital. We have no idea what's wrong with her. We've been waiting for a call for days. Every time we turn up at the hospital, nobody's there to see us, and now they want to discharge her and we don't think she's any better. So we will go in and improve the communication, find out what's wrong, delay the discharge if it's necessary, or find another private hospital or another hospital to discharge the patient to for some respite before they go home. So typically it's the family or a friend of somebody who's in hospital, or somebody who is got early stage dementia and who needs some support at home. So we both think it's the most rewarding job we've ever had. That's what we do in patient advocacy in Australia. Bye now.